Good morning to all. Today we'll discuss the interior of base of the skull as well as the cranial vault. Now I am removing the cranial vault. So now you can see the cranial vault or skull cap I have removed, and you can also see the interior of the base of the skull. So we'll discuss one by one. This is the base of the skull. So when we observe from inside, this cavity, this base of the skull is divided into three fossas, that is anterior cranial fossa, middle cranial fossa and posterior cranial fossa. First we'll discuss the anterior cranial fossa. So what are the boundaries of the anterior cranial fossa? So anteriorly you can see this frontal bone. So anteriorly frontal bone, and posteriorly what all you can see? The posteriorly, this is the lesser wing of the sphenoid. This is the lesser wing of the sphenoid, anterior clinoid process, and this shallow groove here which is called as the sulcus chiasmatus. So these are the boundaries. These are the posterior boundaries of the anterior cranial fossa. This elevation is the anterior clinoid process. Now coming to the floor. What are the contents you can see in the floor? So I am just zooming it. I hope it's little bit clear for you. So anteriorly in the median region you can see this C-shaped cribriform plate of ethmoid. This C-shaped. This is called as the cribriform plate of ethmoid. This is in the anterior part, and in the posterior part you can see this. What is this? This is sphenoid, body of sphenoid. So this body of sphenoid, this area is called as the jugum sphenoidale. This is the jugum sphenoidally. So this you can see in the floor in the median region, and in laterally what you can see in the floor area. So laterally, this anterior part you can see this orbital plate of ethmoid. So this is the orbital plate of ethmoid, and posteriorly you can see this lesser wing of sphenoid in the floor. So floor is over. Floor I have taught you in what you can see in the median region and what you can see in the lateral region. Features and attachments. So first you can see this elevation in the median crest in this anterior wall, this one. That is known as the frontal crest. This is the frontal crest, and this gives attachment to the falx cerebri. Okay, now this tooth-like projection, I'll keep it. You can see now clearly this tooth-like projection, upward projection in the cribriform plate. This is called as the crista galli of the cribriform plate. In between this crista galli and this frontal crest, here you can see, in between here you can see this, I hope this is clear for you, a blind sac which is known as foramen cecum. Usually this foramen cecum is blind. Okay, cecum means blind. So sometimes it can transmit emissary vein from the nasal cavity to the superior sagittal sinus. So in between this two you can see here this blind sac. This is known as the foramen cecum. Now this cribriform plate, here you can see some perforations or sieve-like perforated bony plates, small sieve-like perforations. So actually what happened is, olfactory nerves, they pass through this perforated plate from our nasal cavity, from here nasal cavity, olfactory mucosa to the olfactory bulb here through this cribriform plate. This I already told, this is jugum sphenoidale, and actually this separate this anterior cranial fossa from the sphenoidal sinus. And this orbital plate of the frontal bone, they actually separates this anterior cranial fossa from the corresponding orbits. Now this jugum sphenoidale, they continues laterally on either side as lesser wing of sphenoid. So this is the lesser wing of sphenoid, and this lesser wing of the sphenoid ends medially. They ends medially as anterior clinoid process. So this is the anterior clinoid process.